Good morning, students, Form D students. Just a small class, the last class for alkaloids, a subdivision of alkaloid amines, the nitrogen which is not present inside the ring structure. And also, this I have taken because you have done the lab for ephedra, which contain ephedrine and norepinephrine. So, that's why I want to take the this session to give a practical event which we have done in the lab, and our lab section also, that means the TS also have to be shown in this class, so that it will be easy for the students to remember and to do the lab and as well as to write the final exam. This is alkaloidal amines, the last topic which is taken from the alkaloids. So alkaloids may be asked for 5-mark question or in a 10-mark question. The student should be able to write, to condense all these points. Actually, the many classification whichever I have discussed, you can make it into small hints which may be helpful for you to answer these type of questions, especially for the Form D students. And you can see here the proto-alkaloids, which is coming under the classification of the alkaloids, which is some of the amphetamine, that is methamphetamine and ephedrine. What is the structural variation if you want to see this structure? When you see, that is, for example, amphetamine, you have an NHCH3, that is, nitrogen is outside the it's not inside the ring structure of the benzene, or it's not a heterocyclic ring structure, I can say in the other means. And methyl group, when it is attached with that NH2, one hydrogen is removed and methyl group, then you can say methamphetamine. And then if you are having an alcoholic group in that CH OH, that means that C is actually, it becomes all atoms attached to that carbon atom which is present OH group is different. So it's an that is chiral carbon atom or asymmetric structure which is having an configuration of dextrorotatory and levorotatory, or it have a chiral carbon atom. So the plane of rotation, when a plane polarized light falls on the ephedrine, it can be converted into pseudoephedrine also. So that we will discuss the constituent which is present in ephedra. So alkaloid like amines, you can say these are alkaloid like amines, have no nitrogen as part of the heterocyclic ring. You can see this is the basic structure to remember. For example, ephedrine and adrenaline, these all are examples. Both causes, for ephedrine and adrenaline, both causes dilation of bronchial muscle or asthma, bronchi. Asthma treatment can be used. Increases heart rate. Palpitation may be increased when someone is treated with these drugs for asthma patient. So peripheral vasodilation and peripheral vasoconstriction, not dilation, constriction. I am just correcting it. Peripheral vasoconstriction. And dilation, we have to say bronchial dilation or bronchial muscle dilation, which can help in treatment of asthma. So ephedra, this is the plant which is grown in the bank of a river or the sides of the lake, bank of the lake also we can say. You can see the stem part which we are taking the section and which contain the active principle of norepinephrine and ephedrine is present. So you can see the synonym for ephedra is mahong, because it's mostly identified by China, and so that it is present in China. So you can see that is a synonym of mahong. And ephedra consists of the dried aerial part of ephedra gerardiana. Wall is the scientist name, and ephedra Seneca Steph, and ephedra equistenia is also Bunge is a scientist, and ephedra nebrodensis is Tenico, is a scientist who have identified this plant. So these are the species which other there are other species also, but these all are belongs to the family Ephidraceae family. So easy for the students to remember. Ephedra gerardiana, Ephedra sinica, these all are very common even in India. So geographical source, it is mainly found in China, India, Nepal, Turkey, Pakistan and Bhutan. So these all are the geographical sources which you have to write. And Ephedra gerardiana, the picture which I have shown, you can see the stem part with nodes, and the stem nodes will have sometimes stipules, leaves are also can be seen in the stem nodes. So it consists of cylindrical wood part or woody stem in grey or greenish in color, nodes, internodes, scaly leaf and terminal buds are present in the stem. So this a special character which you should mention for the macroscopy. The distance between the nodes or the internodes is 2 to 4 centimeter, and the nodes bear the scaly leaves. They are bitter in taste. Microscopy, which I want to mention because we have done in the lab, this is a schematic diagram. The whole stem when you take, you can see transverse section of the stem shows the epidermis composed of thick walled and quadrangular cells in the bigger section. You can see in 45x very clearly, quadrangular cells covered by thick cuticle. And you can see in the ridges, actually the mainly vertical ridges, you can see that shunkened stomata are present between many vertical ridges in stem also can be observed. So epidermis, the stomata, shunkened stomata in the secondary ridges, which we can observe, and hypodermal fibers, actually hypodermal, the top, that pink, that is also some of the fibers which can be seen very clearly, which I want to specify here. They are not very dark, they are shown, but these all are grapes like hanging, which we can see that is an unlignified cells. And pericyclic fibers will be lignified, xylem and phloem, that is fibers, and xylem and phloem can be seen, that is xylem. Then fibers, even the fibers can also be seen, and in the center part, in the pith, we will see browny matter of mucilage is also present. So these all are points which the students should keep in the mind before drawing the diagram. So this is the clear picture of an ephedra in the plant, green plant in live. You can see it is in the banks of the river area. We can see this ephedra, and the dried stem which is present in our lab will be like this, and it's a beautiful experiment. And when you give beautiful and absolutely very good structural appearance in the microscope by means of taking thin film, thin section like this. This is taken in our lab. In our Sri Krishna College Pharmacognosy lab, we have taken this section and stained, and we have seen in the microscope by means of my, in that small microscope, I have taken this picture. And you can see this very clearly. But the section was not focused properly. That's why we were unable to see the outer epidermis with that unlignified cells. There is no pink color in the below the cuticle. And you can see the middle part, the pith area, there are brown spots, which is that mucilage. And before that, you can see some pink spots are there, which is the xylem and phloem cells, which is not very prompt to see in this section because it is not focused properly. So papillae are present in the ridges, that is unlignified below the ridges, which we can shown in there, that is the papillae. They are grapes hanging like below the ridges. This is the thing which I used to ask the student to show, the unlignified cell or non-lignified cells which is present in the epidermal area of the outer region of the stem. Can you show it in the microscope? We used to ask with the student in the lab. when they are doing the final exam. This is a question, main question any examiner can ask. Hypodermal fibers they are, but they are non-lignified. They are grapes-like thing. If you focus properly, then you can see very clearly the appearance without, even I have shown with some of the students in our lab. So most of them I told them to show that. That is an important specific identification for ephedra. 9 to 20 per group are present in that. And cortex area, when you come down, composed of collenchyma, a round cells, collenchyma, thick wall, and outer zone of radially elongated cells, and the inner zone is spongy parenchyma, can also be seen. Cortex also contain few isolated fibers. That's what few isolated fibers are. That is lignified. Groups of fibers, 2 to 6 per group, are also lignified, can be seen with pink in color when you stain with fluoroglucinol. This is the another picture of that same another session which is taken, and we can see this is that what I told, the hanging grapes like unlignified near to the epidermal area, the outer region of the stem, which will be clearly seen in 45x, and even 10x also we can see very clearly. This is the picture which is taken by the microscope in our lab. So you can see very clearly the hanging grapes like fibers which are non-lignified cells, which can be seen very clearly. When you want to see the structural appearance, the papillae are present in the ridges, below the ridges, and a group of non-lignified hypodermal fibers, 9 to 20 per group, are present. And this is then another important area where the middle area, where the browny appearance which is present in the pith area, which is the mucilage, browny mucilage. Pith is large and with rounded cells containing dark brown mucilaginous substances in the pigment cells. So this is the section of the half area, or small area, which is enlarged into 45x to show you. And you can see that pericycle is composed of group of lignified fibers in the middle and outside the phloem region, where you can see there is an phloem and xylem region. Pericyclic fiber, phloem and xylem will be their vascular bundles of 6 to 10 in numbers, radially arranged in the cortex and composed of phloem and xylem. So you can see this is the epidermis. And even there will be stomata, Shangan stomata can be seen, which is observed, which is not marked, which we can see. And the yellow color arrow which shows that unlignified fibers, and lignified fibers can be seen in the cortex region. And then pericyclic fibers above the phloem cells and the xylem cells. And in the pith area you can see there is a dark brown, that is why the blue color, you can see the brown mucilage cells are present in ephedra. So very clearly these all are the parts which the students have to mark, and clearly you can write the microscopy, which is very, very important drug. Chemical constituent, when you talk, the ephedra contains alkaloids, ephedrine, water soluble salts of alkaloid, and pseudoephedrine, analog of ephedrine, norepinephrine or norpseudoephedrine, an analog of ephedrine. And the leaves and the stems of ephedra also contain many potential active compounds such as tannins, saponins, flavones, and volatile oils. So this is a structure everybody knows. This is an ephedrine structure. Ephedrine structure, you should say that is benzene with CHOH. In that carbon atom is the chiral carbon atom. So that you can see a chiral or chiral carbon atom, which is having an all different hydrogen, OH and benzene, and CH2, NH2, CH3. CH3 is the another substituent. So all of them are different. So they have their own plane of rotation. So you have the pseudoephedrine and ephedrine, they are similar structure. Only thing is above the plane and below the plane of the OH, it shows that is the rotation of the different atom of the plane of rotation, which can give an levorotatory and dextrorotatory, which shows that pseudoephedrine can be seen. So chemical test is a very interesting and important chemical test the student can remember. A drug is taken, the powdered drug, 10 grams in a water, 1 ml added, and dilute 0.2 ml means 1 or 2 drops of HCl. Copper sulfate 5% solution, 1 drop. 0.1 ml means 1 drop, and sodium hydroxide solution 2 ml is added, and liquid turns to violet. The liquid is aqueous, so it turns into violet. On the addition of non-aqueous solvent ether, ether is lighter than water, so it will float in the aqueous region, and shaking vigorously and keeping for settling down, separating them, they will separate automatically. The ether layer turns purple and the aqueous layer becomes blue. So you can see this color, the ether layer is turning to purple and the aqueous layer is blue in color. This is the difference which you can see. The violet color of the solution, initial solution of the aqueous, is converted into blue, and also the purple color will be formed in the ether layer which you have added. So what all the chemicals you need, that is ephedrine, which I told the drug contain ephedrine. Because of presence of ephedrine only, you are getting this color identification or qualitative test tube which you can identify. So ephedrine, that is, or ephedra powder with HCl, dilute HCl, copper sulfate of 5% solution and sodium hydroxide solution, ether, and then you can get this type of reaction can be seen. And uses, when you want to talk about every uses, as I told PharmD student, every pharmacological action of any plants or anywhere you study in this course, it is very important for you to know about in detail about that pharmacological activity, and as well as what is the classification, what all drugs available. These all things you should make, and in the home also, if you find any drugs, any usage in the disease in your home, you have to immediately get the chance of studying about that and improving your, updating your knowledge to the to competitive world. So you can see ephedrine is an anti-allergenic. So allergy, anti-allergenic or antihistaminic, these all words you should go in detail. An anti-asthmatic, antispasmodic, and decongestant. Decongestants are, we are using always sometime nasal decongestants. We are using common when the sinusitis blocking. Decongestants, we used to use the vascular, that is peripheral vascular constricting agents also. Sometimes they are used for decongestant. So you study about what is decongestant, what is the use of this decongestant in the nasal area, why they are using this, and what is its action, mechanical action, mechanism of action, pharmacological action, therapeutic activity. These all things the PharmD students should refer for, and they should keep in mind even the herbal drugs are used and what is the constituents. These all are very, very important as a pharmacy student, and as well as a PharmD student. A doctor in pharmacy student have to thorough with your therapeutics and as well as pharmacology should be in your fingertip for the clinical activity and clinical practice. So cough suppressant, it is a cough suppressant and a stimulant, and it is a vasoconstrictor, that means the peripheral vasoconstrictor. It can be used. Pseudoephedrine is a decongestant and cough suppressant, and norepinephrine is a peripheral vasodilator used in treatment of angina. So there we have told vasoconstrictor, stimulant and vasoconstrictor in the nasal area. So the student have to undergo what is the action of decongestant and how the stimulant and as well as the vasoconstricting effect will be useful for any type of sinusitis block in the nasal area, how it is applicable, what is its therapeutic action. These type of things I just insist the students to go for reference and to acquire the knowledge and to see that. And you can ask with your pharmacologist teacher also to confirm that. And if any doubts, you can even approach me. It will be helpful for you to make more clear about this doubts and clear in the pharmacology of action of herbal drugs. So as a whole, it is a decongestant. Again and again decongestant word is used, and you should know what is the use of decongestant, how it can be used in our nasal area, how its therapeutic action as a decongestant to constriction of the vasoconstricting effect, which can also expel the sputum and open the nasal area, and it can be helpful for asthmatic patient. How it is very, very important for the students to know about that. It opens the sinus, increases sweating, dilates bronchioles, and anti-asthmatic use diuretic, CNS stimulant, raises blood pressure, elevates aches and rheumatism and elevates hay fever, cold, etc. So you should know all the things, whichever the action which I have given, please refer and study. Thank you. Thank you for being with me. And also, as I told, it's necessary for PharmD students to refer more about the use of herbal drugs and also know about the pharmacological action and therapeutic activity of the herbal constituents and the drugs whichever present in various formulation, also very, very important. Thank you.